Hey guys, Tony Maritato here, licensed physical therapist, and I wanted to answer a question that came in today in our Facebook group, the rotator cuff repair support group for kind people. So Jay was saying today is 3 weeks post-op, and his shoulder seems to be clicking and clunking, and it wasn't doing that before. So first, not knowing you, it's really hard to absolutely diagnose what's going on, but I want to give you some information that you can maybe talk to your physical therapist about. Typically what we see is the first 2 to 3 weeks, earlier on in the recovery process, the shoulder is more swollen, the shoulder is more inflamed, it's tighter. You're not moving the shoulder as much. Certainly post-op, assuming it's a rotator cuff repair, you're not allowed to move the shoulder. I don't know exactly what your procedure was, but what I typically see is that as the shoulder starts to heal, once you get closer to that 4-week mark, there's a little more motion available in the shoulder and there's new movement patterns, because a lot of times if they did a repair, if they did any kind of debridement, if they cut away pieces of the bone or bone spurs, you're going to have some of that clicking, clunking motion that's going on. It's also important that you understand or figure out where it's coming from, because it could be coming from the AC joint, which is where the clavicle and the scapula meet. It could be coming from how the shoulder blade sits on the rib cage. It could be coming from the SC joint, which is the joint right in here between the sternum and clavicle. There's lots of things that can click and clunk. So I would tell you, number one, as long as it's not severely painful or you're losing function, it's not necessarily a bad thing. It's probably because you're gaining motion and there's less swelling and tightness inside the joint. Typically what we see is we see this happening around weeks 3 and 4, and then by weeks 6, 7, and 8, it completely resolves and you have better range of motion, more normal range of motion. So I hope that answers your question. Talk to your physical therapist about this. It's absolutely a common scenario. And guys, if you have questions about your shoulder, please feel free to post your questions in the comment. Check out our Facebook group. If you want to see what YouTube recommends you watch on the next video, go ahead and click on this thumbnail right here, and I'll catch you guys on another video.